Welcome to another edition of And Now the News with yours truly, Bill Amos. And my guest this week is Dr. Lyne Filiatrault, who is one of a group of critics of Dr. Bonnie Henry and Adrian Dix over the way they have been handling the pandemic here in British Columbia. But I must say, she is also a very famous doctor in Canada, because back in 2003, Dr. Filiatrault was the first physician in this country to discover a case of SARS. Is that not correct?
That is correct. Yes, at VGH, a patient arrived who had just returned from the now famous Metropole Hotel in Hong Kong. And I had happened to read the communication from the BC CDC that same morning before I went on shift, warning us that there were both atypical pneumonias happening in mainland China, and also that there was an expectation that we would be faced with a severe bird flu coming out of Asia. And so when the patient was wheeled into the emergency department by our triage nurse, and I started getting the story, I immediately thought that it was actually that bird flu because he had just come back with his wife from Hong Kong. But it would later turn out that it was a new disease. It was SARS. The only person who got infected from him, there was nobody on the flight from Hong Kong that got infected. The only person that got infected was his wife, who had been looking after him.
Quite a pioneering moment, I'd say. Now, in the current situation, you're one of the key members of a group called Protect Our Province, which is comprised of many doctors and healthcare workers and other concerned citizens who've been lobbying for a stronger battle, if you will, against the virus. So in your view, what's the worst thing that's been going wrong in the way BC has been trying to deal with this disease?
The biggest error in the pandemic, in my mind, in British Columbia, has been not listening to or following the precautionary principle, and also not evolving the stance of public health as the science evolved. So the biggest failure has been not acknowledging and acting in accordance that this virus is spread through the air that we breathe, that breathing, talking, singing, all of these are aerosol generating procedures. We have basically been seeing waves after waves of infections, and we have most notably been complicit in infecting patients in hospitals, healthcare workers in hospitals, in long-term care, and also not putting the safety measures in place in any indoor setting. Now we need to have air quality standards. The good thing about that is not only will it help us with COVID, but it is going to help us with the sick building syndrome. In addition to that, as we saw last year, forest fires are, going to be a fact of life, it seems, with this climate change. So having increased quality of indoor ventilation and air filtration, as well as monitoring what is good air quality, is going to serve us well, not just for this pandemic, but in years to come.
Let's say that they had not made that mistake, that they had acknowledged that the disease was being spread through the air. What kind of a difference would that have made?
I think it would have changed a lot of things. We're now 2 years into this pandemic, and we still haven't put all the measures we need to put in long-term care, in schools, and even hospitals. So if you think about schools, we haven't made the investments that we needed to make in having the proper MERV 13 HVAC systems in our HVAC systems in schools. In the schools that don't have mechanical ventilation, not all the classes have portable HEPA filtration. I realize cost is an issue, but there is a simple solution in Corsi Rosenthal boxes that can be basically jerry-rig by individuals and schools themselves at a very low cost, perhaps $100, $200 at most. And then we haven't done like Quebec now that finally has put CO2 monitors in many of its classroom. This should have been done a year and a half ago. And here we are in March of 2022, and we haven't done that to keep our kids safe.
I don't really understand unless it's like just a dedication to well, for want of a better term, outdated thinking.
It is outdated thinking. It is completely. Some of the aerosol scientists have done a good job of going back and looking at the literature and seeing where do we go so wrong. And the reason it's important is that if you understand aerosol, is that there are both short range and long range aerosol. And so if you and I were close to each other, and I was, lo and behold, infected with COVID, I could infect you via short-range aerosol. And I'm way more likely doing that than spitting in your face or emitting ballistic droplets or anything like that. And then the other big thing to think about is if we spend time in the same room that is poorly ventilated, like classrooms, many of our classrooms, what happened is over time, the virus is suspended in the aerosol in the room. And therefore, it doesn't matter that you are beyond 2 meters, you will get infected. So there's a lot that we could have done if we listened to the scientist. And for some reason, the people we put in charge, the so-called experts, have denied and refused to look at the science. And in fact, if you look at it, have almost been condescendent with the aerosol scientists, whose job it is to understand climate change and have spent way more time than anybody in healthcare studying how aerosol form and how they spread.
So what do you think is going to be the future of the disease here? Now not we, but the province has dropped almost all protections. There's no more mask mandate, certainly not in schools. It's kind of advised if you go out in public to wear a mask, but I don't know about you, but I've noticed since those regulations were relaxed, the number of masked people in your grocery store or public places is it's going down quite significantly. So how do we get out of this mess?
Well, let's start with what do I expect? I expect that we're going to be no different than what's already happening in Quebec and is going to be happening in Ontario. So in Quebec, the cases today, I just saw one of the headlines, there are 3,000 cases. So those are the ones they're testing. So we know it's much more. Their hospitalization are also seeing an uptick. And in Ontario, you saw this nice graph circulating of their sewage data, their wastewater treatment plant data showing uptick in the virus. And Peter Uni of the Science Table in Ontario says, based on what he saw last week, they're probably at 25,000 cases of COVID right now and ticking up, right?
Wow.
So we're going to see the same thing. It's happening in Europe. You saw in England and in Scotland, the cases are going up and hospitalization are going up. And it's going to be exactly the same here. In fact, one of the modelers, Jan von Bergman, shared that if you look at the hospitalization by health authority, they're going up for Vancouver Coastal and Fraser Health. So the hospitalization already are going up. You're not seeing that because we're using all of BC together. But if you just isolated those two health authorities, there's an uptick in hospitalization. So we're going to be in the same situation. And in fact, we may be worse. Because if you recall, BC was late at immunizing, giving the third dose in long-term care. We waited for Delta to be upon us before we rolled out third dose in long-term care and clinically vulnerable. Unlike Ontario and Alberta that had been immunizing late August, early September. So we started immunizing late October, early November. So we're on to the 5th month of people in vulnerable long-term care in terms of their third dose. So that means they are at risk of infection again. And same thing for the clinically extremely vulnerable. We are due for another dose, and it should be happening now.
Looks like BC is going to have to do another major backtracking move.
Yeah. Yeah. And like you said, we removed the mask mandate in public transit, in schools, and really we're basically setting ourselves up for failing. So we're decreasing our protection while at the same time our vulnerable groups immunity is waning. Add to this that the public basically is thinking COVID is over, when in fact it is not over. And the most dangerous time in a pandemic, according to my friend who is an expert in epidemic, Dr. Joanne Liu, who is the past president of Doctors Without Border International, the most dangerous time in a pandemic is when in your mind you think it's over because you drop your guard.
Oh,
yeah.
Well, this could be
and Bill,
this could be a very bad time.
Yeah, let me add one more thing as well. Is that well, two more things. The other thing is that there's a myth out there, and I don't know where it's coming from, that people think, hey, I got Omicron, I'm okay against BA2. And that's wrong. We're seeing in the UK that there is reinfection happening after people got infected with Omicron. They are getting reinfected with BA2. So we don't know the exact number because it seems that people have set a limit for classifying reinfection as 90 days. You need to be 90 days out of your previous positive test. And that may be a fallacy. It may happen faster than we think. So that's number one. So no, you're not immune if you've had Omicron. So don't get rid of your mask just yet. And then the other thing that I wanted to say is we haven't addressed how the virus spread. So nothing has changed. We're removing the precautions, yet we're not addressing how it spreads indoors. And until we understand that we need to address ventilation, clean the air, and allow people to wear the best filtration at their face level, which is N95, we're going to keep having this cycle of infection amongst our most vulnerable in long-term care setting.
Many of us are baffled as to why the leaders of this province continue to make decisions like this, as if it is an endemic, as if there's nothing much to worry about, and they're not seeming to be vigilant. So one hopes that once the numbers start to go up, they'll kind of like come to their senses, I guess.
But again, it's exponential growth.
Mm-hmm.
So we've removed all the methods of tracking this virus, save for wastewater, and wastewater is about 10 days behind.
Mm-hmm.
Right. So we need to be 2 steps ahead. And that's really where we need to be. Why are we not tracking people testing with rapid tests? And I mean both the positive and the negative, so that we can have a surveillance process on that can say, hey, look, the number of rapid tests turning positive is going up. And at Christmas, if you look at it, instead of rolling out third dose, we actually closed clinic. We told the people that were measuring the sewage data to take a holiday. You can't have that. You need to have everything on all the time so that we can surveil and say, hey, it's back. We have to let the public to be, to be aware. If you don't tell them when they went to Christmas at Whistler, the test positivity rate around Christmas was 25% plus. And yet you were telling them, go have a great holiday, and you can go to a restaurant and take off your mask for 3 or 4 hours. Made no sense, right? So we need a layered approach. We need to be 2 steps ahead, and we need humility to say, we were wrong. We can't go back to normal. We need to build a fairer and a better normal. And the countries that have done the best are the countries that have cared for everybody. And if you look at the United States, they have such a poor safety net. They've done awful. We need to have everybody safe in order for us to be safe. Because if you allow this virus to take hold in part of your community, it'll come back in the rest of the province. We saw that with Delta in the north, right? They weren't doing well. What happened then? Cases were transferred here, and then people's surgeries were delayed. And we're basically affecting everybody by this poor handling of the pandemic. And the quality of healthcare we're able to provide, because we're burning out our healthcare workers, and also because we're providing access to a longer and longer waiting list. At some point, we're not going to be able to provide the standard of care that we as Canadians think we deserve and we expect.
Well, Dr. Filiatrault, thank you very much for coming on the podcast, and thank you for your information. It's pretty serious, and we can only hope that it can help to influence a change of mind in the people who are supposed to be setting the healthcare policy. So I know you're going to continue to be on top of this, and we'll continue to follow you in that pursuit of proper policy. And again, thank you very much for coming on.
Thanks for having me on, Bill. Take care.
All right. You too.